My name's Beverly Lakey. I'm the program manager of the AWC Employee Benefit Trust, and I wanted to talk a little bit about an impactful experience that made me really understand how much I wanted to work for the association and help folks out with their employee benefits. I've been working at AWC since the late 1990s, so I've been there 23 years now. And I kind of came upon it in maybe an accidental way, which I think can be the way a lot of people come around to working in pools. I had a background where I worked in a physical therapy and did some business office work, working with healthcare benefits. And I also worked for a nonprofit agency later. So kind of those two combined led me to the association and working in the Employee Benefit Trust. I initially started answering phone calls for members and really found that rewarding and helping folks. And I got particularly attached to an individual who had some serious mental health problems with his dependent child and needed to help find care for that child. So I was a resource for that individual. They would call me. I would help them through the process and finding facilities. And if anyone knows about mental health care in children, there are very few facilities in the United States that will take a child in an inpatient basis. So we were working through a myriad of situations, and we'd get 2 steps forward and then go 1 step backward. And again, we had this long relationship where he was calling me, and he didn't have to start from square one. We'd had these conversations. I knew where his care was at, or his dependent daughter's care was at, and we would just go from there. And I started working with case managers, and we'd get them more involved, and ultimately would get this child to the appropriate care at the appropriate time. But I think, as anyone knows, in a mental health situation, it's not a one and done. So there was an ongoing relationship that I had with this particular family and individual, and it really was rewarding to be able to help them and to get them to the direct care. So I think at that moment, I realized that this was the career for me, and this is the position that I wanted to stay in and grow within the Employee Benefit Trust. And kind of ending to the story is, after a year or so of dealing with this individual, he did send me some flowers that I received in thank you for all of the work that I had done on behalf of him and his family. So that's a story about me and the Employee Benefit Trust and some of the reasons that I've stayed for as long as I have.